most importantly, when evaluating a peripheral blood smear morphology, when you see a lymphocytosis, the most important diagnosis to make is this reactive or is this neoplastic? Neoplastic conditions should typically show identical looking cells. Since the neoplastic cells are all coming from the same clone, they should all appear very similar in the peripheral blood. In this case, we're looking at a case of mantle cell lymphoma involving the peripheral blood. Here we can see that most of these cells have a moderate amount of cytoplasm and one or two very conspicuous nucleoli. All of these cells that share these features are part of the same neoplastic clone. It is very difficult to make a specific diagnosis of a specific lymphoma or leukemia based solely on morphology. However, morphology is important in identifying that there is an atypical population of cells with nearly identical morphology, which is suggestive of a neoplastic process. And seeing a population of cells with similar morphology may lead you to suggest ordering some ancillary studies such as flow cytometry. Here's another example of a lymphocytic process where the lymphocytes in the peripheral blood appear more similar than they are different. This is an example of a splenic marginal zone lymphoma involving the peripheral blood. You can see that the lymphocytes in this case, the neoplastic lymphocytes in this case, show a moderate amount of cytoplasm, one or more conspicuous nucleoli, and an ovoid nucleus, some showing vacuolization. We wouldn't be able to make a diagnosis of splenic marginal zone lymphoma based solely upon this peripheral blood morphology sample, and therefore it is very important to correlate your morphologic suspicions of a neoplastic lymphoid population with ancillary testing such as flow cytometry, cytogenetics, and/or molecular studies. In this case of splenic marginal zone lymphoma involving the peripheral blood, we see a characteristic morphology with lymphocytes showing these villous cytoplasmic projections, not to be confused with the hairy cell projections seen in an earlier case. Here again we see the cytoplasmic projections in splenic marginal zone lymphoma, which would be very difficult to distinguish from hairy cell leukemia morphology without clinical context.